An introduction to ozone therapy at home. First of all, just really quick on this particular summit, all right? And this is a picture of my family. Hopefully you can see that. This is, though, a picture of my family about 3 years ago, because I have a 3-year-old now. We don't take many family pictures. And so what I wanted to do, though, with this summit is to assist pet guardians in restoring the health of their beloved pets by providing the best possible information on ozone therapy. That's my goal. And so that is exciting to me to be able to do that. What is ozone therapy? So it's a gas, right? And some people say it's a toxic gas. And I'm going to say yes to that. True. It's a toxic gas when we inhale it. So that's the one way we don't administer ozone therapy. We never want to breathe in ozone therapy as a means of administering ozone. Breathe in ozone as a means of administering it. A little bit of smelling ozone here and there is fine. In fact, I did that this morning. I did an ozone treatment myself, and I smelled ozone. Not a biggie, but again, that long-term exposure to ozone is not good for our lungs. So we want to be careful of that. I'm going to breeze through this. Many of you already know this stuff, so this is foundational. Just want for those who don't to be aware of it. It's 3 oxygen atoms sharing electrons. They don't share well. They're kind of like my 3-year-old sometimes. So it breaks down quickly. It's one of the most powerful sterilizers on Earth. It has a very short half-life. It's very reactive, and so we cannot store ozone for long periods of time. You're looking at 30 minutes to a couple hours, depending on the temperature, etc. It is very temperature dependent. Okay. What's the problem? Okay, so this is where I'm going to give a disclaimer. Ozone has some varied and unique mechanisms through which it works. I will share with you one basic and central mechanism here today. Recognize that if you go read my book, or if you go look at some of the studies, or go listen to other lectures, you're going to get some other information. And it's not necessarily wrong information, it's just different. And that's because of the varied way with which ozone works. We call it a biological response modifier. What does that mean? It means that it's modifying how our body works. It's modifying the biology. It's modifying how cells interact. And so that can be very complex. And that means that there's a few different ways in which it's going to work. And ultimately, those mechanisms will have a number of downstream effects. Here's where we're going to start, though, with one of the big problems in sick animals, or sick people for that matter. It's blocked bioregulators. Okay? And what does that mean? Well, you see on the screen H2O2. Anybody know what that stands for? You get a thumbs up if you do. If you chat it in now, what's H2O2? I'm going to tell you it's hydrogen peroxide. So in our body produces hydrogen peroxide. And hydrogen peroxide, believe it or not, it is one of the most critical cell signaling molecules, okay? When we have a healthy pet, we have a correct amount of these bioregulators, one of which, the most important when it comes to ozone therapy, is hydrogen peroxide. When we have the correct amount, we have what's called redox signaling, okay? Redox signaling is really not that complex. It's a process, a continual process of reduction and oxidation that's occurring in our cells, okay? And when we go into that, it could get a little more complex. We're not going to go into that. But this is always, it's a cycle that's never ending in our body. And as that reduction and oxidation is occurring, and there needs to be a healthy balance in our body of this, it produces intracellular signaling. So cells talk to each other. and they let other cells know, hey, you need to produce more immune cells. Hey, you need to produce antioxidants. Hey, you need to stop producing those. Hey, this is an issue. We need to fix this. All of those types of things are going on. And redox signaling is the way through which that is occurring. Well, when we have a healthy number of hydrogen peroxide molecules, you have physiology happening. You have a normal cell, healthy cell. When you have a dysregulation in the system, okay, when that's dysregulated and you have an overproduction, an abundance of these bioregulators circulating, or not enough of those bioregulators in the body, you have a blocked signal. Think of a cell phone tower. And when you get a mountain in between you and the cell phone tower and you're trying to talk, it's just breaking up and you can't get the information to the person you're trying to get it to. That's what happens in our body. And when that happens, you have oxidative stress. And it's like this short circuit that happens, okay? And then it leads to pathophysiology, or the breakdown of the cell, okay, with oxidative stress. That's the problem. That's a major problem, a big problem. Well, what happens when that happens? Systemic chronic inflammation happens. And you've heard of inflammation. You hear of inflammation all the time. If you want to go look this up, this particular chart came from the link down below on the slide. You have all of these issues going on, okay? And this does not apply just to animals. It applies to humans, okay? So you've got dysbiosis, obesity, physical inactivity, infections that contribute to diet, all of these things that lead to and contribute to disease, okay? In the pet and in the person. So you've got these metabolic syndromes and diabetes, you've got cardiovascular disease and cancer, depression, it changes our moods, autoimmune diseases, neurodegenerative diseases. There's all of these things that chronic systemic inflammation and at the start, this dysbiosis of bioregulators contributes to. So that's the big problem. When you have that going on, the unhealthy side on the left, you've got that block signal, it leads to pathophysiology. We introduce ozone, okay? Yay, woo! How does ozone change things? How does ozone help? Well, it helps by basically taking the place of helping to regulate these bioregulators, okay? So redox signaling is improved, or it is changed in such a way that leads to the correction of this block signal and this oxidative stress that's happening, which leads to physiology. It leads to a proper cellular response and proper cellular energy and health. Leads to a healthy patient, okay? That is ultimately how we should view ozone therapy and how it works. There's a lot of biological effects. One is antioxidant upregulation. So it stimulates the production of antioxidants, which are crucial to cellular health. Immune system regulation, germicidal activity. These are some of the ways in which ozone is working to produce a healthier pet. Improve blood flow and oxygen uptake. And you'll hear a lot about that, oxygen uptake, because it is crucial. It is important when we talk about ozone therapy. And lack of cellular oxygen is really, really a major component to health, okay? Lack of cellular oxygen leads to many of the things we just talked about. It leads to the breakdown of the mitochondria, breakdown of the cell. It leads to not enough cellular energy. It leads to oxidative stress. It leads to chronic inflammation. Man, so many things. So when we talk about ozone therapy, these are some of the things we're talking about. And I'm going to back out one more time and just make sure that everybody's with me because I'm just afraid that this is not translating to what you guys are seeing. Is everybody hearing, seeing everything going well on your side of the fence there? Great. Okay. All right. That's promise. Last time I'll do that. Okay. What is ozone therapy? Here's a definition. Now, this is my definition. I am not a veterinarian. I am not a medical professional, but this is something that made sense to me. Ozone therapy is a medical treatment that uses activated oxygen, or ozone, to treat many chronic and acute diseases. It reduces chronic inflammation, it destroys pathogens, and activates the immune system. It can be applied topically, infused into the blood and tissue through various means, or introduced into a fluid or oil, which acts as a carrier. Okay, so that's the basic definition of ozone therapy. If some of you have a better way to say this, hit me up. Send me an email, revise it. To be honest, I know there's a better way to say it, but this is at least a good start to what ozone therapy actually is. So how does it help your pet? And I'm going to come at this in a unique way. When we talk about ozone therapy and we look at success rates, okay, what can I expect? Is it going to heal my pet? Is it going to do what I want it to do? We need to understand a few things, okay? Principle number one that we need to understand: ozone is a biological response modifier. Or another way to kind of think about it is as an immunotherapy. In fact, I had a call from a veterinarian yesterday, I believe, talking about immunotherapy that this pet was on and asking whether or not it would be a wise thing to use ozone therapy alongside of this immunotherapy. Because ozone itself acts as some sort of immunotherapy, but not in the traditional sense, okay? So anyways, it enables the body to heal itself. That's really what we want to get at. And guys, you need to understand this. We all need to understand this. When we talk about ozone therapy, or when we talk about, let's just pick a few things: light medicine, maybe it's laser, maybe it's ultraviolet blood irradiation, diet, herbs, acupuncture, electromagnetic medicine and stimulation there. When we talk about these types of treatments, we are not talking about a pharmaceutical that acts upon a receptor in the cell in a synthetic way, in a way that's just really very specialized to that particular disease and that particular result that we're looking for. We are looking at a holistic, that's the best way I know how to say it, a holistic treatment method. We're looking at something that is taking the long road, and you are committed to that. You're first, do no harm. You don't want to introduce toxic chemicals, toxic treatments into your pet. So what you're trying to do here, and what you are able to do, is you're able to stimulate a biological response in a very natural way. Did you know our body produces ozone? It's been scientifically shown, the signature of ozone, they say. Signature, because ozone reacts so quickly that it's gone in a matter of milliseconds. They can't get a view of ozone in the body, but they see the signature, the byproducts of ozone created in the body. So ozone is endogenous. It's something that's created by our bodies. Principle number one. Principle number two, success rates will vary depending on the variety of criteria, including the following: the disease being treated. These are no-brainers. The progression of the disease, the pet's age and overall health, the frequency of the treatment, underlying root causes, other treatments, and lifestyle choices. All of these things are going to determine oftentimes how successful the ozone therapy is going to be. For example, if I am building a house, okay, and one day I go and I am working really hard, I'm putting up, the structure, I'm building the walls, I'm tipping those up, I'm sheeting those and, moving really well and working really well. But then the next day I come and I take a Sawzall and I start cutting through these walls and cutting through the studs, my building is going to collapse. Okay? And the same thing is true of health. When we treat it with something here, but over on this side, we're chipping away at the foundation of health, well, the reality is we probably are not going to get the result we're looking for. So just a way to view it and to understand it. We're going to look now at some actually very specific conditions. And what you'll see here is what the condition is, and then what the success rate is, and then a link to the particular study that I drew this from. Now, when we talk about success, realize that varies as far as what actual success looks like. In some cases, it's not complete healing, okay? So in some cases it is. But just be aware of that. You can go do your own research later. Fungal infections, 75%. This was ozonated sunflower seed oil. And the type of fungal infection is going to vary as far as success rate. Mastitis, 50% success rate, okay? Vaginitis, 85%. And you're going to ask me, oh, okay, well, wait, hold on a second. How did they use ozone therapy in here? What were the protocols? All of those types of things. I'm sorry, we don't have time for all that. But if you want to go look at the studies, if you want to go look at the abstracts, you can find out what they used. And be aware, this is science, right? So they're kind of testing out different things. Not all of these people who did these things, not all of these scientists who did these were using the best protocol possible. So I don't always look at the protocol and think, oh, yeah, we should do it that way. Sometimes it's like, no, why did you do it that way? So be aware of that. Infected tooth, 77%. Peripheral arterial disease, 90%. This was autohemotherapy, okay? So that's taking out the blood, mixing it with ozone, and putting it back into the body. Foot rot, 60%. Okay, this was combined with PRP, or platelet-rich plasma. Faster wound healing. You have the effects of subcutaneous injection of ozone. Remission of VX2 tumors, 43%. Okay, this is tumor growth and metastatic spread in rabbits. Okay. Herniated disc, 90%. Great treatments and great outcomes for some of these. Better quality of life. So you have a test or a study that shows the quality of life improved. And again, we have to take a holistic approach. These studies are not taking a holistic approach, but we still want to know, okay, when I use ozone therapy, is it going to be successful? Is it going to help? Is it going to be something that I need to do? And the answer, more oftentimes than not, is yes. So how do you get started? Consult your veterinarian. You need a treatment plan. You need veterinary oversight. You may need an oxygen prescription. So realize that, okay? If you need more information on this type of thing, let us know. But those are things that we can't offer. Purchase your equipment. Many of you already have it. Probably most of you already have it. Most of you are already doing this, so I'm not going to belabor this point, but there's lots of different things. In fact, yes, there's lots of different things you can purchase that would be helpful, from nebulizing the ozone through oil for breathing ozonides, to rectal insufflation, to bubbling fluids, to limb bagging, etc. Okay? Get trained. Oh, so this is exciting for me. If you guys were not aware of this, we actually have a training course now available for pet guardians. And I believe it's only 79 bucks. So it's not that expensive. It took me a long time to make it. So it's 4 hours in length. So it's not overly long. That's about 20 videos in it. It's a series. So if you go to vetozonetraining.com, you can find that. This is some of the training that you can get. You also, again, need veterinary oversight. And then just start treating. Talk with your veterinarian. Make sure you have all the equipment. Watch the administration videos, and you can contact us with any questions. Okay, so you're not in this alone. You have help. We also have a Facebook group that is pretty active. So if you're on Facebook, look for Ozone Therapy for Animals. Just search that and you'll find our group. You can ask questions there. Sometimes I'll answer questions if I'm on Facebook. And other people, though, are really good at that. So do that. If you're a veterinarian, we have a WhatsApp group and you want to be a part of that. Jump into our WhatsApp group, download the app, WhatsApp, and then ask me how to get access to our group, and I will give you access if you're a veterinary professional. Move forward with confidence. You need confidence. You need to know what you're doing, but it's not that hard. You guys can do it and we can help you. Okay. Here's a few things. Now, I get a lot of questions about oxygen, and I want to just share this up front. The air we breathe is 21% oxygen. Okay. An oxygen concentrator, like you see in the picture here below, will give you somewhere between 90 and 95% oxygen. All right. Industrial grade oxygen, which is held in a tank like this that you see on the right hand side of the screen, gives 99.5% oxygen. Medical grade oxygen, on the other hand, is wildly different. It gives 99.5% oxygen. If you didn't notice the sarcasm there, they're exactly the same grade of oxygen, the industrial grade and the medical grade. Okay. There are other grades of oxygen: food grade oxygen, ultra high purity grade oxygen, research grade oxygen. The higher you go, the more expensive they get, and they're unnecessary. There are also other grades that are not listed here. I just want you to know, if you go to a medical supply store and ask for a medical oxygen tank with oxygen, you'll get the 99.5% medical grade oxygen. That's what you want. If you go to a welding supply store and you ask for a tank for welding, an industrial oxygen tank, you will also get 99.5% medical or industrial grade oxygen. The difference is how they validate the purity of the tank. And so they though, in both cases, they're going to flush those tanks out multiple times with oxygen, make sure there's no impurities in that. After that process, if you have a medical tank, they have to verify the purity of the tank. That's the difference. If you need a veterinarian to help you with ozone therapy, there are televets. So there are veterinarians who do telemedicine, some that only do telemedicine, and they can help recommend ozone therapy for you and help you get set up with some of that. You can go to o3vets.com, and we have a find a vet link in our menu where you can find a veterinarian, maybe, as you note here, if you're in North Dakota, Washington, New Mexico, and multiple other states like Nebraska and Wyoming. I know you're out of luck. Actually, this isn't up to date, this picture, but I'm just saying there's a number of places in the US that they don't have a veterinarian close by, and I'm sorry, I wish they did. So we're working on that though. Okay, that's all. That is my presentation. I'm going to stop sharing that now. And what we're going to do is we're going to move to the next session, which is the Q&A, okay? From Keith, we have any results or experience with valley fever? Yes, Keith, there are actually some results and experiences with valley fever. And so I would say this can be a successful treatment with valley fever. In fact, one of the very first testimonies I had on ozone therapy from one of our veterinarians was on this particular area with her dog in valley fever, where she couldn't get the traditional medications to help heal, and ozone came in and did the trick. Okay, Kathy asks, what is a protocol for dogs with glaucoma? How effective is it? Is the drainage duct inflamed, and does ozone decrease inflammation to allow drainage? That's a great question, Kathy. And it's a question that I can only partially answer. For the rest of these sessions, you will, well, for most of these sessions, you'll also have a veterinarian alongside of me to help answer these questions. And so that will be good because there's some things just I can't answer. But I would say that a protocol for glaucoma is going to primarily be the use of ozonated saline. Okay, so when we have anything that's related to the eyes, we're going to use saline, ozonated saline, and saline in particular because it's a physiological solution, and it mimics, the fluids of the body, and so you can flush and wash the eyes out with that. You can put it subcutaneously, of course. With many of these local conditions, we definitely want to get ozone into that area. We want it to get direct contact. But oftentimes, it's also a good idea to do a systemic treatment alongside of that. So you may want to consider, as part of the flushing of the eye with the ozonated fluid, and just flushing with ozonated fluid for 15 to 20 seconds, once to twice a day, doing rectal insufflation beside that as well. And I cannot answer. It is an anti-inflammatory. Ozone is in particular, in and of itself. So I would say it's a great thing to allow for the decrease of inflammation. But I'm not sure about the drainage duct, etc. How does it work? Oh, and you can ask anonymously if you prefer that. No problem. Go ahead and do that. I didn't know that until I just saw that somebody did it anonymously. So good job figuring that out. So attendee 1, how does it work to breathe O3 as a treatment if it's toxic? It doesn't. It doesn't. That's the answer. But I know I confused you. That's not the answer you're looking for. I confused you when I talked about nebulizing, probably, with ozone. So we can't breathe ozone gas. But if you take, the generator and you hook it up to a breathing mask and you just put ozone right into your breathing area, you're going to cough and choke and sputter, and it will not be a good thing. But if you first connect a bubbler, an oil bubbler, to your ozone generator, and you can see how that works on our YouTube channel. There's some videos on that. Just type in oil bubbling. Go to youtube.com/O3vets, and you can watch that process taking place. But if you first bubble the ozone through the oil, then we can breathe the vapor that comes out of that oil bubbler, and we connect that to a mask. In fact, I was doing that the other day here, and you can very safely, you won't smell ozone. Naja asks, is the pet parent training a certificate? Do you get a certificate? You do get a certificate, but it is it's not recognized as by any external organization. So just keep that in mind. But yes, you do get a certificate that you have completed the training, ozone therapy training from O3 Vets. If you want to know the WhatsApp group and you're a veterinarian or vet tech, you just email info@o3vets.com, and we will provide you with that information. Naja again asks, what about protocols for animals versus humans? Are they similar? And the answer is yes. Almost always they're exactly the same. The only difference is going to be the dosing. So for humans, of course, usually that's going to be a little more than a small animal. But for the most part, it's exactly the same. Okay, and I got to watch my time. And I have to watch and make sure. So, okay, 11:15 is Jenny Dean. Jenny, are you here? I don't know if you're here or not, but hopefully you will be soon because mine will come to an end, and then Jenny Dean is going to join us. Okay. Let's see. And if you are, don't worry about it. I'll get to you, Jenny. Sorry. That was a side note. If ozone increases perfusion and causes oxygenation, how would that not worsen a neoplastic process? Wouldn't tumors thrive on the additional blood flow, etc.? Victoria, very educated question. And that is a great question for some of our veterinarians. The answer is no. There have been multiple studies done on tumor and ozone and tumor oxygenation. And the net result is that we have a decrease of perfusion, a decrease in tumor size, generally speaking. And again, that varies. But no, it doesn't contribute to the growth of tumors, contrary to what maybe would seem intuitive. And that's where ozone, the body, and ozone being a biological response modifier, it actually helps to incite an immune response. And whereas you're allowing healthy cells to absorb and utilize oxygen more efficiently, it's not just, hey, we infuse ozone into the body, or we infuse ozone around a tumor, and all of a sudden, bang, you've got all this oxygen there. It's not how it works. The ozone is absorbed, and it's the downstream effect that the ozone has on healthy cells to help those cells utilize oxygen more efficiently that is really at play here. It's not this massive infusion of oxygen into the body. Will ozone therapy help with luxating patella and collapsing trachea? I feel like we have a few veterinarians asking questions here, maybe. Those aren't normal questions, but they're good questions. And the answer, if you ask, I don't want to just give my own opinion. If you ask our veterinarians, I will address the luxating patella. I would say yes. The problem can be, of course, stabilizing that joint as it heals. Ozone therapy, you'll see some videos on our website. You'll see some studies on patellas, and ozone therapy can be helpful in those situations, but we have to take a multimodal approach, I think. Collapsing trachea, I don't know. I would say no, but I don't know enough about that. Okay, we're getting close to having to end my session. For a dog with a chronic untreated ear infection that have bulging, inflamed ear tissue as a result, has ozone ear insufflation been helpful? Both treating the never-ending goo, doesn't sound healthy, as well as reduction of the inflamed ear tissue, to your knowledge. Yeah. So we have a treatment protocol. Treatment protocol is going to depend on the ear infection and whether or not you can infuse anything into that ear. But yes, ozone has been helpful in these types of situations. In fact, there have been times at which, actually, you're going to see a testimony later today that has to do with this. So stick around, Beth, because I think that one is actually towards the end of our time, but that one will be interesting for you. It was submitted by Charlene Goodworth. But yes, I would say this can be a fantastic treatment for those particular conditions. Subcutaneous versus IV versus rectal. Why choose one over the other, Nancy? That's a great question. I would say, to our knowledge, it usually doesn't matter. Okay, rectal insufflation being the administration method of choice because it's just easier and faster usually. IV fluids, if you're already going to be using IV fluids and you have to administer those anyway, you can ozonate some of those, so that might make sense. And blood draw, IV, you're talking about major autohemotherapy, drawing blood and reinfusing it with ozone and putting it back in. You might want to do that, especially if you're going to be doing ultraviolet blood irradiation at the same time, because you've already got blood, it's outside of the body, you can treat it with another treatment and put it back in. That's, as far as O3 Vets is concerned, that's when we would recommend major autohemotherapy over rectal insufflation, but they're very similar. Most of my fear was of getting started, making a mistake. How easy is it to get started? Safety margin of rectal, oh man. It is, I will let, so guys, can some of you who are in the here chat and answer that question? How easy or difficult has it been for you to get started with this and to go forward with ozone therapy? Go ahead and chat that into the chat area if you would. And I guess I'm putting myself on the spot doing that, because I'm sure for some people it has been challenging, and for others it hasn't. I would say though, in general, it's not that difficult to get started. That's why though we offer, when somebody purchases equipment through us, we offer a 1-hour live Zoom training with them, so that when they get their equipment in, we being me, can go over what they're doing and make sure they're comfortable, as well as, of course, having the support of veterinarians. That's also good. It's not that difficult, and it's a very safe treatment. It's just, we, like anything, you want to know a few basic things to do it right. Okay, we have to end. Bovine mastitis, there is no lecture on that. We can do that in the Q&A though. And I'm guessing, I don't know how to say your name, Clara, but I'm glad you're here. I'm guessing, because of how it's spelled, that you might be an international participant. Glad to have you here, and we can answer some of those questions in the panel discussion. That might be when you're asleep. I don't know, depending on where you're located. Jenny, hi, you're here. Good. Okay. All right. Hi, Dr. Dehan. Nice to have you. I don't know about drinking water versus rectal insufflation. That's a good question. Don't really have any information on that. So, all right, guys. So Jenny Dean will be our next speaker. That's it for me. I am going to end this session. We're going to start her session up and get her in there and get her going. So thank you for being here. If you enjoyed this, if it was beneficial, now is when you would clap. If it's not, that's okay. I understand some of you, this is review. There's a lot of people who mentioned that it was easy. Hardest thing, not having a vet specific plan. Some of you had teachers. Good, great, excellent. So we're going to end this session and we'll start the next one here